I would like to introduce our presenters for this session from Covenant Health, Mr. Stephen Grubbs, President and CEO, Mr. Stephen Forney, Chief Financial Officer, and Uday Madhasu, the CIO. Today in the session, they're going to walk through their experience in navigating a cyber attack event. They'll also offer insights on the decisions that had to be made during the event, and then also, at the end of the day, lessons learned moving forward. So with that, I'll let Uday come up, and thank you.
I get to go first. Well, good afternoon, everyone. I hope you can see me. I can't really see you because the spotlights are right in my eyes. One observation from the very beginning, I noticed Mr. Forney must have done this a couple times. Doesn't he look comfortable up here? It's like, I've done this a time or two. No, really, it's a pleasure to be with you today. My comments are going to be brief because these are the experts, from Covenant when it comes to our cyber event and what happened to us. But wanted to share my insights as CEO. Picture on the screen behind me. This is a nice little cafe in Destin, Florida. Anybody ever been to Destin, Florida? Almost everybody. I know you have. Well, my wife and I, Memorial Day, were having lunch at this cafe. We're actually sitting at one of those tables there on the sidewalk, having a nice lunch, and my cell phone rings. And so Memorial Day, cell phone rings, lunchtime. You don't expect it to be your chief information officer. So you can see the phone call was from Uday, and I can't actually see the time stamp on there, but it was somewhere around, 12:46, something like that in the afternoon. So I'm thinking, Memorial Day, having lunch with my wife, going to fly out that afternoon and return to Boston. The CIO calls me. I'm thinking, this can't be good. This can't be good. I mean, I like Uday. I do. Just, calling on a holiday, he knows that if he's going to call me on a holiday, it's probably going to be really, really important. And lo and behold, it was. It was really the beginning of the communication around an event that happened that we discovered that morning at Covenant. And an event that we want to describe to you. Hopefully you have never been there. People ask you all the time, what keeps you up at night? And one of the things I used to say was the threat of a cyber event, a cyber attack. I can honestly say now, yes, that does keep me up at night. It kept us all up at night as we endured this cyber attack for a period of 3 weeks or so. And so today we want to talk to you a little bit about that, share with you our experiences, share with you our lessons learned, and share with you some tips from our perspective that would be helpful to you if indeed this ever happens and you ever find yourself in this situation. So Uday, I believe, was that my last slide? No. Oh, yep. Yes, it is. Okay, I'll turn it back to you.
Okay. Thank you, Steve. Good afternoon. My name is Uday Madhasu. So we have a brief agenda. We are going to talk a lot about what happened, how we dealt with it, what we learned from it, and we are going to offer some tips because for all of us in the room, this is the world we live in. These things happen almost every day. If you haven't already had the pleasure of experiencing such an event, you'll be prepared for it. You'll look forward to it. This is life. So buckle up. I know it's late afternoon, so we appreciate all of your attention. But to start with, quick poll. Now, the way this poll works, for those of you that have your cell phones, whip them out. You can either take a picture of the barcode, or you can just pull up slido.com and type in that code. And it's an interactive poll. As you all answer, hopefully the poll will work. Now, remember, as you take this poll, there is no right answer, right? It's just a perspective of who you are, what organization you work in, how you would react if you were in the middle of this. So no right answer. All answers are good. So feel free to click one of the options. Now, on purpose, I did not make it a multi-select because I didn't want everybody checking all boxes. So we'll see what the room says. So the room says call IT. Love it. Keeps me gainfully employed, so I appreciate that. Thank you. Moving on. Thank you. So, very famous screen. I have a little story here. Now, if any of you are seeing this screen on your laptop or desktop, if you've seen it today, if you've seen it this week, if you've seen it last week, you got problems. Come and see me after the meeting and maybe I can help you, but this actually goes back to the summer of 2024. So this is a screen that was very, very popular back then, July 2024. People saw it in airports, we saw it in banks, we saw it in healthcare. Any guesses what I'm talking about? Yes, CrowdStrike. So CrowdStrike is a very, very popular cybersecurity company, very popular. They're a global company, tons of customers. Unfortunately for them, in July 2024, they had a true leadership test in crisis management. So what had happened was, in their usual operational mode, they pushed an update to their sensor called the Falcon sensor, which sits locally on endpoints, laptop, desktop, servers, what have you. And they had a problem with one of their updates, and it started crashing any device that had that sensor, and if it was using Microsoft Windows operating system. So you can see there, because of that faulty sensor update, over 8.5 million Windows systems crashed across the world. It wasn't isolated to any one country. It wasn't isolated to devices. So it was Microsoft Windows operating system devices across the world. And it had widespread disruption for a couple of days. Airlines, banking, healthcare. It was a major catastrophe for that company. But the reason I wanted to use this is not so much what happened. We are not going to get into the technical detail of what happened, but how the company and its leadership responded. How they responded in a moment of crisis, because that's what we are going to talk about today. So George Kurtz is their CEO. He's still the CEO. And what the company and George did when they were in the middle of this crisis was swift action. They worked collaboratively with everybody. We've heard about collaboration a couple of times, so same theme. CrowdStrike had to work collaboratively with a lot of people in the middle of that crisis. But they also weren't shifting blame. They took accountability for their actions. They said, we made a mistake, and we are going to do it right by all of our customers. And their communication was excellent. They were front and center. George was himself talking to media, providing updates on social media platforms. So the company and the leadership did a fantastic job of being front and center in the middle of this catastrophic crisis. Now, CrowdStrike is a publicly traded company. Their stock price over that period plummeted by almost half. But today, they're almost 3 times where they were. So they've done very well, and it's truly a testimonial to their leadership in crisis. So what were the lessons learned for the rest of us? When you have a crisis, act fast. Own the crisis. Communicate clearly. And of course, we all want to prevent these things from recurring. So even the most secure enterprises can fail. These things happen. They have a way of happening even to the best of us. And resilience is not about avoiding incidents. You just can't. It's going to happen. Resilience is about leading through them. And that's the story I think we also unfold with CrowdStrike. So with that said, I'm going to request Steve to do a little introduction of who we are, Covenant Health. We also have one of our partners that lived through this experience with us, NewRealm Long80. So Steve, if you want to introduce Covenant and NewRealm.
Thank you, Uday. You can see on the slide Covenant Health. Obviously, we're a Catholic healthcare system based out of New England. We stretch from Bangor, Maine, as far as Scranton, Pennsylvania, with our reach. You can see the number of facilities, acute care, post-acute care, on the screen there in front of you. What you don't see is that in addition to this, we employ over 300 providers within our network. So any incident regarding a cyber threat event, system downtime, it's going to impact a lot of users. Uday mentioned our partners, and we have several key partners as a system. I shared those this morning in a slide that I shared with you, the key partners for Covenant. One of them is a company called Long80, NewRealm, the parent company. And obviously they are our provider of ITIS operation services. I will say up front how important that function is when you have a cyber attack, cyber event. You've got to have strong key leadership and support around you to react, and to react quickly, as Uday said. You have to react fast. And we had just that. Uday's an exceptional leader for our system, but in addition, he had that added support of the principals from NewRealm to be right there, to walk him through, to provide support, provide whatever was needed in a time of crisis. So in addition to that, I mentioned also this morning our revenue cycle partner. You might think, well, how do you think of revenue cycle when you're under a cyber attack? But as we all know, we're talking about patient care and the viability of patient care. And who touches that more than your revenue cycle folks, whether it's on the front end or the back end or anywhere in between. So Ensemble Health Partners was right there with us along the way. In fact, Stephen, I think maybe the day after, maybe 2 days after, there was an army, a team of 15, 20 people at our home office that had set up a control center, and they were helping us with all things revenue cycle and patient access related.
Thank you, Steve. I love the theme for the annual meeting today, the power of partnerships. Both Steve and Larry talked about community and collaboration. Another great story, just around the summer of 2024, when CrowdStrike incident happened, we back then were not yet a CrowdStrike customer, so we weren't impacted directly. But our friends down the street, Tufts Medicine, a good friend of mine, Dr. Shafiq Rubb, he's their chief information digital officer. They were a CrowdStrike shop and they got hit. So Dr. Rubb reached out to his community for help. And over a weekend, we had our field support team physically deployed at Tufts Medical Center, walking the floors, working with the Tufts team, and we helped them fix the CrowdStrike issue as much as we could. And that goes to show just the power of collaboration. We all help each other. So I really appreciate both Steve and Larry talking about the importance of community and collaboration. I'm going to talk a little bit generally before I get to the specific incident. So this is to give you all an idea of what we are dealing with in the industry. Now, I know that there are many of you here in the room that are not necessarily from the healthcare provider space. You may be working for other healthcare life sciences companies, suppliers, but I think what we are sharing here applies to all of us across the board. It's not unique just to healthcare provider organizations. According to recent surveys, 93% of healthcare provider organizations faced a cyber attack in the last 12 months. 72% of those reported that these attacks caused some sort of disruption to operations and patient care delivery. 67% of healthcare organizations experienced specifically a ransomware attack. Ransomware is a type of cyber attacks, malware. Average recovery time when an organization is dealing with these kinds of incidents, anywhere between 8 to 10 weeks. And healthcare is the third most targeted industry right after manufacturing, and then finance and the insurance sector. So we are a target. That picture, right, below on the left side, I know you can't see it clearly, but that's a visual to show you each of those squares, the blue dots, are aligned by day of the week and then the 12 months. And as you see, the dots kind of started in 2022, really picked up pace in 2023, and look at how busy the chart gets on in 2024. The bad guys have been going to town, and they don't take days off. You can't see on that, but they're working evenings, nights, and weekends. So ransomware attacks are on the rise. Many of us are dealing with it. Average cost of a ransomware attack, well over $5 million. How does this happen? They have lots of different ways they can exploit weaknesses in the infrastructure. Sometimes it's exploiting vulnerabilities because we use a lot of technology in the work we do today. Sometimes it's brute force password attacks. They're simply guessing the password, and they keep guessing until they crack it. So you want to make your password about 100 characters long if you can. Compromised credentials. Many of us sometimes click on a link we are not supposed to click on. We open an attachment we are not supposed to click on, and you type in your username and password. Well, the bad guys have it. So lots of different ways for them to attack us. Now, why do they do it? Very simple. Financially motivated. Just like Steve alluded to the power of data. Our data is valuable, and they're going after our data. That's why they're coming after us. Our data is valuable. So we owe it to the patients in the communities we serve and our staff, our employees, to protect our data at all costs. And that's part of the work that we have to do. This graphic is not really that great, so I'll just talk about it. So why is this happening? And when these ransomware attacks happen, they don't happen overnight. Sometimes they take months because the bad guys are doing it in stages. They're very organized, they're very resourceful, they're very knowledgeable. And sometimes they have access to better tools and resources than many of us in the room here. So the ransomware attack usually happens in 5 or 6 stages. There's an initial access stage where they're trying to figure out how to get in the door. Then they're doing more reconnaissance, what are the weaknesses. Then they're trying to dig deeper and go broader. Then they'll actually get hold of your valuable data, could be protected health information, could be personally identifiable information. They try to take the data, steal the data. Then they deploy the ransomware, which effectively locks you down. It encrypts all of your infrastructure. And then when they have you really in a corner, they ask for money. They ask for ransomware. They're trying to extort money out of you. And the reason this happens is because over the last 20 years, as we have digitized a lot of our work in healthcare, the attack vector, the attack surface has expanded. We have so much equipment that we now have on the network. Could be desktops, could be laptops, could be medical equipment, could be all kinds of things that are now on your network, and all of those make these things much more easier to happen if you don't secure them, you don't protect them. And that's why you see more and more increase of these ransomware attacks. So that's just a view of how these things unfold. Specifically, I'll get into what happened at Covenant, but I got one more poll before I get there. So if your critical systems went offline for 48 hours, what would hurt most? Now, I know that not all of you are healthcare providers, so I understand the option about patient care disruption, but for each of your organizations, think about what would hurt most if you were down for 48 hours. Same thing, you can scan the barcode, you can open up Slido and enter the poll. So obviously the first and foremost is patient care disruption, but equally important, reputational damage. We want to protect who we are because we do great work. Staff communication breakdown, it really affects your employees in the organization. And of course, organizations get hurt financially. So like I said, no right answer. All of these things happen depending on who you are and what kind of an organization you are. So what happened at Covenant? One of the things I want to mention is, back in March 2025, I had approached our Covenant leadership team, and I made a request for our organization to move away from our existing cybersecurity platform vendor to CrowdStrike. Thankfully, the Covenant leadership team approved it. We signed the contract, and we started implementation in April. And we were kind of going through that. And then this event happened on Memorial Day. One of the services that we also bought from CrowdStrike as our partner is this service called Overwatch. It's very simply a security operations center service where the CrowdStrike team is watching what is going on across the world and our environment, and they alert us when they see something wrong. So we actually got a CrowdStrike Overwatch alert on that Memorial Day about 7:47, sprung into action. We engaged with them. We actually had CrowdStrike helping us do what's called as incident response. So they were doing the forensic investigation, helping us with recovery. So that's how my Memorial Day morning started. So obviously, we are now in the middle of a ransomware attack. We were a victim of a ransomware attack by a group that is very, very sophisticated. So what happens when these things happen? Right off the bat for us, clinical impact. We lost access to some of our clinical applications, our electronic health record application, our lab systems. So when these systems are not available, it affects the clinical operations and our ability to deliver patient care. So we had a clinical impact that we had to deal with, and people had to figure out how they're going to continue to deliver patient care. The other issue immediately for us is operational impact. Supply chain gets impacted, finance gets impacted, payroll gets impacted. So lots of operational impact in the back office functions. Then as this event was unfolding, we also lost connectivity to a couple of systems. But at the same time, one of the good things that happened with us is because we were able to identify the issue very early on, we were able to minimize the impact of the issue. So it didn't take us completely down. We were not completely shut down. We had a lot of other critical infrastructure. For example, our email was working fine. Our internet access was working fine. Many of our applications that are in the cloud, they were all working fine. So we were partially impacted, but we had other aspects of our infrastructure that were working. That was very important for us to rally our troops and continue to provide patient care, because we did not say, stop taking care of patients. Very, very important for us to continue to take care of patients, even in the middle of this crisis. So what I want to share with you all is, even though for us the incident was partial, it does cause major disruption to the healthcare operations. And that's what we were dealing with. We were partially impacted, but we were dealing with the disruption for about 3 weeks. How did we respond? Steve, you want to talk about our leadership response?
So this is probably one of the areas that I'm most proud of when you think of how your leadership team responds. One of the things we did was, and obviously this is a very logical first step, is the assessment. You pause and you assess the enormity and the scope of the situation you're in, asking those questions: who, what, when, where, how. And then step two is protection, right? We want to protect patients first and foremost, protect our staff, but also we want to protect our systems and make sure that all of our assets are protected in the process. So we had that consideration first and foremost. We wanted to communicate. I don't know how you folks in your organizations communicate when you have something critical to share with your key leadership. We have this word that is used that when it shows up on your phone as a text and it says Rocket Man, we all know what that means and we know how to respond. Rocket Man means stop. There's something critical we have to communicate. Immediately go to your computer and follow the instructions to dial in to our virtual meeting. So we established the communication through Rocket Man. One, communicate out to everyone the situation. Not everyone understood or knew what was happening at that point. And two, to really start gathering leadership consensus around next steps. So next steps, activate. That was very important. Establish your command centers. When you have a critical incident, you need to establish a command center. And then develop that cadence of updates. Now, this says daily updates. In our case, when we first started, it was multiple times a day. There was a morning command center meeting. There was an afternoon report out. So we were frequently reporting out, the situation, what was working, what wasn't working, and some of the critical next steps during the process. Engage the experts, that's without saying. We had no clue what we were dealing with, so what did we do? We called the experts. I would say first phone call that you need to make is your cyber insurance carrier, right? You've got to notify them, let them know that you've got this situation going on. Now, we did that. Fortunately for us, our cyber insurance carrier had been down this road a time or two. And that was very helpful to us because they pretty much said, you need to do A, B, and C. You need to call this firm for this service. You need to call this firm for this service. Very helpful information for us because they knew what we were going to experience in the days ahead, and they knew how to help us prepare and call in the right resources to help us get back to where we needed to be. And then communication plan in general. Uday mentioned protect the brand. We all know that, information travels quickly, especially on social media and so forth. So it was important for us to make sure that messages were communicated, but communicated well and appropriately, so that there wasn't misinformation and there wasn't a panic within our communities or within our facilities regarding what we were experiencing. And so that communication plan was key, so we engaged the right people to help us even with that, and made all the difference in the world. So leadership response, these are 6 things that I think are crucial. There are others, but these are the things, looking back, that we say, we did these things, and thankfully we did.
Thank you, Steve. So as this was going on, first 48 hours, we had a mandate. We needed to contain this spread of infection. That was our goal, because we didn't want the bad actors to get any wider or dig any deeper and steal any of our data. So that was the focus, containment. And we worked with a lot of partners. CrowdStrike was helping us. We engaged with the FBI, the local FBI field office was involved. We had a handful of other partners. Our partner Neuron was involved. But the focus in the first 24, 48 hours was contain, contain, contain. And we did lots of things. We had to strengthen firewalls. We had to do recovery. We did lots of things. I won't bore you with the details. I'll make sure that you all have a copy of the presentation. But the end goal was successful. Within about 48 hours, we were able to get to a point where we were able to ensure that we saw no evidence of persistent threat actor activity within our infrastructure. We stopped them in their tracks. Now, damage was done. We have to deal with recovery, but we at least got to a point where we weren't letting them do any more damage in our environment. And that was a major, major milestone. And we got to that point just within the 48-hour mark. Then the focus is recovery, right? Now that you've contained, then we focused on recovery. And this is where we spent a couple of weeks trying to recover from the incident. Some of the work my team and I did, which was more technical recovery, bring the servers back, bring the applications back, bring the connectivity back. That was fine. But the most important part of the recovery is really where our leadership came together under our CFO, Steven. Steven, you want to talk about some of the recovery work?
Yeah, thank you, Uday. One of the things to think about recovery, and it sounds sort of like after the fact, but, recovery really started, we started laying the groundwork for that almost on the first day. Steve had mentioned that we had a small army from Ensemble deployed at the corporate office. There was a equally large army deployed throughout the system at our various sites. And the goal around that was, obviously they're not doing technical items because that's Uday's team, but they're saying, how do we make sure that we're capturing documentation? How do we make sure that we have appropriate downtime procedures? How can we help the clinicians with documentation and capture of information so that when the systems are restored, we actually have we actually have everything we need to recreate patient records and recreate operations that essentially just took place on paper for the previous 3 weeks. during the middle of this process, we even had laptops drop shipped in with hotspots to take them completely offline from our systems so that we could essentially go through a back door into Epic and be able to register patients and do some rudimentary work around those patients while we were still technically down. And the upside around all of that is when we finally got full access restored to the systems, is we were able to then mobilize a team, multiple teams across the system, ambulatory, pharmacy, hospital inpatient, hospital outpatient, to really get down to essentially the creation of these records from paper and get back on track. Now that probably took us substantially about another 3 weeks to accomplish, but it wound up being there were many lessons learned, but we actually feel like we did a very good job about that. But it was all about preparation and making sure that we had a good team effort around that from the very beginning, all the way through to the end.
I want to just add a couple comments about what Stephen said. I mean, when you're involved in the crisis, you learn so many things about the opportunity that you didn't realize that you would have to think about. Do you have enough paper in your facilities? And how do you get that paper into your facilities as quickly as possible? Because you're going to all of a sudden go from online charting to paper charting. Not only paper, but labels, printers, things like that. So we had a really resourceful supply chain department led by Eric Berger and others who helped make sure that was happening. Then you also have the issue of paper charting in general. I'm not clinical, I'm not a nurse, so I don't really fully appreciate and understand all the aspects of charting with paper versus online or on an electronic system. But what I do know is that we had many nurses across our system that would look at us with a blank stare and say, I'm not sure I know how to do that. I've never had to do that before. And I mention that because it was a very proud moment for seasoned nurses, ones who had been there, who had done that, who had trained that way, to be able to walk alongside those new nurses and to show them and to help them. It was kind of satisfying to see that. Don't ever want to be there again, but you have to think about those things because those situations arise, and they arise quickly.
Thank you. Our supply chain folks are in the back of the room, but they worked very hard because for a good reason, we disconnected their ERP system, so they were pushing paper like there was no tomorrow. They also had to find paper. So we appreciate Eric, Kim, and Sandy in the back. Thank you. Another quick poll, and then we are coming to a close. This is a question. What is the most overlooked part of resilience? How do you build resilience in your organizations? Communication and leadership under pressure. How much practice do your leadership have in dealing with crisis? Staff awareness and training. That's an ongoing work. We want to continue to do that. Technical recovery capabilities. How much does your technical team practice disaster recovery, business continuity? And of course, vendor and partner readiness, because we can't do this by ourselves. We want our community to collaborate and come together. No right question, but these are all things that we want to think about. Communication and leadership under pressure looks like that's the most overlooked part of resilience. One of the ways you build that resiliency is doing tabletop exercises. You have many folks that can help you. There's a lot of content that is freely available. I have some resources towards the end of my presentation where you all in your organizations with your leadership teams can do these cybersecurity tabletop exercises so that you're better and better arming and preparing yourselves to respond in these types of crises. So many lessons learned for us, thanks to my friends that got involved. So first and foremost for us, just the importance of ongoing staff education. We do things on an ongoing basis, almost twice a month. so that we are educating our staff on what to do, what not to do, how to respond to downtime. So staff education, we are going to double down on that. So that was a good lesson learned, and it really, really came in handy. The other important lesson learned for us was making sure that we take a look at our disaster recovery and business continuity plans. Do we have the right downtime procedures? Do our staff know what to do during downtime? Paper charting, making sure they know where the downtime forms are available. Because nowadays, everybody's so dependent on the smartphone and the laptop or a desktop, when suddenly these things don't become available, they're stuck. So making sure that everybody's clear about your business continuity plans. Then there are a couple of technology-related things like data protection, making sure you have really good data classification, data retention, so that you have good governance around how you want to manage your data. I'm going to have Steve talk one more time about the importance of communication, because we cannot underscore the importance of communication. For many of us, communication continues to be our Achilles heel. So Steve, talk about crisis communication and planning.
Thank you, Uday. Well, crisis communication and planning, I guess first and foremost, you know that's one of the key things that you'll be faced with. And what you say, how you say it, and who you say it to is very, very important. For us, we had a lot of folks that we could tap into that had been there before, had been through the same experience and could share those experiences. So if you've not done this already and you fear that one day this could happen to you, go ahead and make that phone call. Talk to these folks and say, what was important around communication? Who did you talk to? What were the expectations? I know when I talked to one of the CEOs in New York who had been through a recent cyber attack, he told me things that were so important. And he said, you know what? Whenever you have this type of an incident, you're going to get a class action suit against your company. It's just going to happen. There are, these attorneys, these firms out there, they just look for this, and this is what they do. And lo and behold, it wasn't much long after that we get our first. And these cases are at times very frivolous, but it will happen. Would not have been aware had I not communicated with that person. He also shared with me some of the things around our cyber insurance carriers and how to go about doing that work, knowing that would be something that once we got beyond the initial crisis phase, that we would soon be involved in. So Mr. Forney's been doing a lot of work around that, trying to make sure that we have all the forensic accounting completed so that our cyber insurance will understand how it truly impacted us so we can submit our claims and so forth. As far as the internal communication is concerned and the importance of that, it is important to have that daily meeting, to have that daily command center call. We had many command centers. We had local command centers, then we had the corporate command center. But you have to establish that point of connectivity. You have to have a communication leader. Pick somebody within the system that's really good at facilitating this kind of thing and ask them to bring the group together. And very systematically, we actually had a standardized agenda that we went through in the calls. Covered the essential key components of what we need to talk about, kept us on track, and made sure that the calls were very timely and they didn't linger on for a period of time. So, Uday, I hope that's what you wanted me to talk about with respect to communication. Yep. But those were the key things for us. Yeah,
very important. We have to communicate with patients. We have to communicate with regulators. We have to communicate with the communities. Everybody's looking for what is going on. And you have to do it in a way that's very intentional, that's very thoughtful, because you don't want to create panic. But at the same time, you want to be transparent. So very, very important to figure this out. And ideally, our lesson learned is to try to template this process. You got to know what you're going to say when crisis happens. Now, you can build these templates, you can buy these templates, you can borrow these templates, but you should have them ready to go and hope to never use them. But that was a big lesson learned for us. We were lucky that we had a partner that was a crisis communication partner that helped us figure out how to do this work. I have a couple of other lessons learned. I'll go through them very quickly. One of the things that we did and we are still doing is really optimize our infrastructure, make sure that we have the right level of resiliency, scalability, redundancy. we really honed down on access management, make sure that least privilege access, implement multi-factor authentication, get rid of accounts that are no longer needed. So a lot of work there. Obviously, ongoing monitoring, continue to strengthen our network security. These are things that are important for your technical team, so you're welcome to take this back to them. But we talked a little bit about this, but I'm going to have Mr. Forney talk again about partner readiness and how that really came to bear for us during this crisis.
Yeah, I mean, just to really emphasize the whole partnership aspect of how did this help for us. Long 80 was the decision that we made. Actually, it's almost 3 years ago at this point that we actually implemented. And I think back to some of these cybersecurity discussions we were having prior to having Long 80 come on board, and I shudder to think what this event would have been like without having that group embedded into what we do and really having them ready to handle this sort of event. Because we would not have been, 3 years ago, we would just not have been ready to handle this event. So, that working with them was a key focus around this. And working with Ensemble to really get the footing right and getting the recovery piece around the financial aspect of this was key for us as well. When the dust settled on this, we got back up and running. I asked, obviously we hadn't been dropping bills or anything because our systems have been down. So I actually asked all of our financial people to put together a cash flow projection for us so that we could understand sort of what we were looking at. And at the end of June, that analysis showed that by mid-August, we were going to be $38 million upside down on cash. And that obviously got a lot of people's attention. But as we worked with Ensemble and doubled down efforts and got additional resources, we actually erased that deficit by mid-August, and so we didn't have a cash shortfall. And so that's the importance of having partners that you can rely on that really have an ability to step up to a next level and drive performance beyond what they would normally be doing. And like I said, that was an amazing effort all around by both of our key partners.
Thank you, sir. All right, so what does that mean for all of you? This is the summary slide. Preemptive cybersecurity. We want to act before they attack, because they are going to attack. They're trying to figure this out every single day, so we've got to try to get in front of it. So what does preemptive cybersecurity look like? It is proactive security operations, and since you can't go to a conference nowadays without talking about AI, I also snuck it in here. So proactive security operations using AI-powered technologies. There are a ton of AI tools that are very, very specifically focused on cybersecurity. They do things like behavior analysis, because usually cybersecurity is bad things happen to good people. So we just have to figure out how to leverage all the tools and the technology in the world to get in front of it. And try to do some things that basically make it difficult for these bad actors to get into your system, difficult for them to dig deeper and go wider, and try to protect as much as you can. Why is this important? Usually detection always lags behind threats. The threat landscape is evolving. As much as technology is evolving, more and more people are using AI to do good things. The bad guys are also using the same AI to do worse things. So usually detection lags behind threats, so we want to try to get in front of it. And the threat actors are exploiting AI and going global with their work. I mean, these guys are very, very organized, and often, you read this in the news, they're state-sponsored actors. They got more resources than all of us put together. And as you think about digital transformation, as you think about bringing new systems, you got to think about them from a cybersecurity. Are these systems not only going to do what we need them to do, but how well are they going to protect us? And at the risk of being redundant, collaboration. This is not an IT problem. Cybersecurity is not just an IT responsibility. It takes everybody in the organization to keep us safe and secure. True collaborative effort. What to watch for and do? Demand vendor preemptive security. Many of you are supply chain folks in the room. When you partner with new vendors, if they're going to access your PHI, they're going to be on your network, they're going to help access critical infrastructure, you've got to ask them, tell us about your security. How do you secure yourselves, and how are you going to help us maintain our own security? Practice disruption. Turn your system off and see what your supply chain people do. Turn your systems off and see what your clinical teams do. You've got to practice those exercises. And obviously, we advocate with all of our leadership to make sure that everybody is aware and they're partnering with us. So that, I think, all of that is probably going to help you all be better prepared. So those are things that we all have to do. I have in my presentation a couple of resources. I'll share this with you. These are useful links. Most of these are from the federal government because both federal and state governments are doing a lot of work here. So there are some very useful guides right down to the details of step 1, step 2, step 3. So hopefully this information is going to be useful. Now, our partner, New Realm, is here. They have these nice little cards that Avijit is going to hand out. The card has a QR code. Just scan the QR code. It's going to take you to a web page where spend 5 minutes and you can do an exercise. And it's going to, at the end of that exercise, give you a score of how well you did and offer some suggestions in terms of what else you could be doing, what have you. So if you have the time, take that 5-minute cyber drill challenge. Now, many of you probably forgot my name. No worries. I shared a tip with my wife 22 years ago. It's a new day with Uday. So, so appreciate the time. Happy to answer any and all questions. Okay. We have a gentleman there with a question. Yeah, great question. So the question is about preparedness, right? What were we doing before, and how much more are we doing now? We certainly are doing a lot more, both internally within my team, but also externally with other departments. So previously, the cybersecurity tabletop exercises were mostly restricted to my team because a lot of my team has, what I'll call elevated access, right? They have access to a lot of things. So I wanted to make sure that they know what to do and what not to do. But now we've extended that. We are now doing more cybersecurity tabletop exercises, reviewing downtime procedures with the nursing leadership, with the clinical leadership, with the administrative leadership. So we definitely have elevated that intensity and the velocity of some of the preparedness. We are taking a look at our entire downtime procedure, policy and procedure, looking at all of our downtime forms, making sure that we don't have too many forms. We have the right number of forms because we don't want people trying to figure out which form to use in the middle of a downtime, right? So clearly, great question, and we are definitely doing a lot more work now than we used to do in the past, for sure. I appreciate the question. Another question that I was hoping somebody would ask, but I'll prompt the question. Many times when you deal with organizations that live through these ransomware attacks, the inevitable question, did you pay? Did you pay the ransom? We did not. One of the best things that happened to us during this incident was we got on it very, very fast. So we minimized the scope of impact. 2, when we started recovering, when we finished containment, now we started recovery. Usually when these things happen, when you're recovering, you need your backups. Sometimes the bad guys know this and they go after your backups. They compromise your backups. We had immutable backups. It made it easier for us to recover from our backups. So with all of this, because we had good partners, we had good counsel, we had good leadership, we made a decision that we are not going to negotiate with these bad guys. We did not pay a ransom. But that's something that you can't be cavalier about. You really have to think through that process and make those decisions very, very carefully. Any other questions? I don't think we have enough mics for all the questions, but any questions for these two gentlemen? Don't ask me all the questions. All right.
Okay, Uday, let me.
Yes, sir.
There we go, finally. As you look back on your experience and a lot of lessons learned, and thank you so much for sharing them, are you in your training taking the iterations of what could have gone wrong, what didn't go wrong, but what could have gone wrong, and really fleshing out the response to those scenarios such as communications lost and all those kinds of things? Do you take that to the nth degree?
100%. You want to talk about the after-action work that we are doing, Mr. Forney?
We actually put together a group to basically go through the lessons learned, and not only just internally, but externally with our partners as well. Like Ensemble did the same thing. And we have gone through and really kind of picked up, okay, here's where we needed to improve, and we're trying to incorporate a lot of those ideas for improvement into sort of the after training to make sure that should this ever happen again, we're not going to have some of the same issues. One of the things we identified was, even though we had policies and procedures for downtime, they were not followed in a standardized process across all sites of care and across all modalities. And so part of the ongoing training now with this sort of thing is drilling that, hey, here's the policy, here's how you do this, and we're going to do this the same way every time, so as an example. And so we absolutely are taking all of this and putting it into the ongoing training to make sure that we have a more resilient organization.
I would add to that, Larry. One of the things that we were curious about was, did this incident truly have an impact on patient care? And, I think we could all say, yeah, it probably did at some point bedside when, staff didn't have ready access to information, but we could see no signs of that. And we really dug hard into our quality data and our exception reporting to see, did anything occur that we felt like we could attribute back to the cyber incident? And, fortunately, knock on wood, we were not able to determine anything that happened. So when you think about what could have, right, that's the biggest fear, is what could have happened, and what can we do to make sure that we were lucky it didn't happen this time. Let's make sure it doesn't happen next time as well, so that it will not impact patient care in any way going forward.
So I just have a two-part question. This is probably for Steve. So you talked about the communication. Can you share a little bit about the communication up, in other words, to your board, and how frequently were you communicating with your board? And then the second part is maybe dive a little bit deeper into like the communication externally to the press, things like that.
Great questions. Communication with the board. Obviously, we did a lot of that virtually and via email, just because we had those tools at our access. But we did it immediately. We let them know what we were facing, and just kept them updated on a routine basis. It wasn't daily. It was probably more like a couple times a week, unless we had some critical crossroads where decisions were made. We had to communicate, but we did keep them fairly well up to date, and that's very important. As far as external communications with outside parties, we're really lucky. We have a national PR firm that we use, and they have experience in this space, unfortunately. And so they knew how to advise us. But our cyber carrier, Beasley, they were really good as well. And, I mentioned earlier, they immediately said, do A, B, C, and D. And that included tips on external communications and press releases and calling firms like we use, so that we can engage in that from the very beginning. So yeah, we did do that, and I think mostly it was driven from our cyber carriers saying, do these things. It's very important.
The other thing we also did is, a couple of weeks after things were back to normal, Steve and I and Steven, we all attended different board meetings because we have a corporate system-wide board and we have local boards. So we actually attended the board meetings to debrief our board of directors and the local leadership a little bit more detail in terms of what happened, how it happened, what were the lessons learned. And I think the board members also appreciated that transparency. And that was a good exercise because everybody now is equally informed so that they can make informed decisions. I appreciate the questions. Any other questions? Great. As my boss, Mr. Forney, says, any meeting is a good meeting if you end early. So we are early. I'm supposed to go until 4:15, but we are a couple of minutes early. So Steve and Steven, thank you. I appreciate your insights. And thank you all for giving us an opportunity.